A crucial update for Medicare Advantage. Understanding the IPS logic change. The Centers for Medicare and Medicaid Services, or CMS, is changing the game for Medicare Advantage claims. This change specifically affects how allogeneic stem cell acquisition costs are factored in.
As of April 7, 2025, this updated logic for the Inpatient Prospective Payment System, or IPPS, will be in full effect. This means big adjustments for payers, pricing vendors, and hospital finance teams. The IPPS is essentially the system used to determine how much hospitals get reimbursed for services provided to Medicare patients.
This new update focuses on how the cost of acquiring allogeneic stem cells, used in life-saving transplants, is accounted for within that system. In simpler terms, the way we calculate the cost of these treatments and who pays for what is changing.
This change is not just about numbers, it's about people. It's about ensuring that hospitals can continue to provide these complex, often life-saving treatments to patients in need. By understanding and adapting to this change, we can help ensure that patients continue to have access to the best possible care.
Decoding the change allogeneic stem cell acquisition and IPPS. Before this update, the cost of acquiring allogeneic stem cells wasn't always clearly defined within the IPPS. This ambiguity sometimes led to confusion and discrepancies in reimbursements.
Now, CMS is providing much-needed clarity. The updated IPPS logic clearly outlines how these acquisition costs should be included in the calculation of reimbursement for hospitals. This clarity is essential for ensuring fair and accurate payments to hospitals providing these critical transplant services.
This means hospitals will need to carefully review their billing practices to ensure they align with the new guidelines. It also means payers will need to adjust their systems to process these claims correctly.
Who feels the impact? Key stakeholders in the IPPS update. This change isn't just about hospitals and CMS, it has a ripple effect across the entire healthcare ecosystem. Let's be clear, payers, including Medicare Advantage plans, will need to adapt quickly to these new rules. Their systems must be updated to handle the new logic for calculating reimbursements.
Pricing vendors, the unsung heroes of the healthcare billing world, also have a crucial role to play. They are responsible for developing and maintaining the software that hospitals and payers use to manage claims. Their systems need a complete overhaul to incorporate the updated IPPS logic.
And of course, hospital finance departments are on the front lines. They are tasked with understanding the intricacies of the new system and ensuring their hospitals receive accurate and timely payments.
Section 4. The clock is ticking. Your action plan for IPPS compliance. The clock is ticking, and the April 7th deadline is fast approaching. Here's what you need to do. First, educate yourself. Familiarize yourself with the specifics of the IPPS logic change. CMS has released detailed guidelines and resources on their website. Next, review and update. Scrutinize your internal systems and processes. Ensure they are aligned with the new IPPS logic for calculating allogeneic stem cell acquisition costs. Then test. Don't wait until the last minute. Thoroughly test your systems to ensure a seamless transition and avoid any disruptions in claims processing. Finally, communicate. Keep the lines of communication open. Talk to your vendors, payers, and internal teams to address any questions or concerns.
Section 5. Beyond the deadline. Resources and support for IPPS implementation. Remember, you're not alone in this. CMS and other industry organizations are here to support you. They have dedicated resources and experts available to answer your questions and provide guidance. Don't hesitate to reach out. This change is about more than just compliance. It's about ensuring the long-term sustainability of our healthcare system. By working together, we can navigate this change successfully and ensure patients continue to have access to the critical care they need. The April 7th deadline is a critical milestone. But it's not the finish line. It's the starting point for a more transparent, efficient, and equitable healthcare system.